Hello, everyone. Welcome back. This is Chander in Palo Alto, locked down at home in quarantine, which in California we are calling shelter in place.
Hello, everyone. This is Arne from Oslo, also locked down in Oslo. Not formal quarantine, but not very far off it either.
Yeah. I hope
And
all of
well,
you are staying safe and practicing good hygiene and not, reading these medium blog posts where everybody's coronavirus expert now. Just, just listen to CDC stuff and whatever your government organization is. It's amazing how everything on social media is about coronavirus. Everybody's writing about it.
yeah, and so welcome back as well, Chandra. I was flying solo with Per Arne last week, so it's good to have you back. And you can rest assured that I washed my hands and sanitized the microphone before going on.
Well, I feel safer now. Hope you enjoyed talking to Per Arne. He's a fun guy, so I'm sure you enjoyed it. It sounded like from the podcast that you enjoyed it.
Absolutely, he's always fun to have around.
Yeah. So with what's happening in the world, I thought we pick a relevant topic that's healthcare or digital health or how we see healthcare changing, and what are the opportunities for startups in the healthcare system.
Yeah, so this is a tangent of the Corona situation, but we decided not to do Corona directly. So as opposed to everyone else in the tech ecosystem, we don't feel that we're contagious disease experts after 2 weeks like the rest of us out here. So we'll deal with the more general topic of digital health.
Yeah, yeah. um, so let me frame the topic so we can get deeper and have a discussion around it. And Arne, you can get into the numbers, how they're so out of proportion in the US and why there's a big opportunity as a VC, you see. But let me frame how I see the total healthcare or digital health market. So I see it as, there are 6 distinct categories. First is wearables. So that is, Apple Watch, Fitbit, Garmin, etc. These are consumer devices that people wear to be more aware of their health. So to make sure that, they're walking X number of miles, their heart rate is on track, and how much the pulse, etc. All the things we want to measure about the body, the vitals. Second is remote health, and that's more related to, one is diagnostics, how you can remotely diagnose people with the symptoms, and you may use some of the wearables to do that. And then within remote health, you also have care. How do you remotely provide care to people, let's say, who are elderly or sick? Third is personalized medicine. I think you can say that part of it is biotech. It's more based on genetics. I think there are a lot of startups here in the Bay Area. After we had Casper Cas9 become available, which is a way to basically manipulate genes. There are many startups in that space working on personalized medicine. Then fourth is AI or data, where you may have read that machines can determine if you have cancer, or they look at an MRI better than a human can because they don't make mistakes and they can see things that humans don't see. Then fifth is pharma, where companies develop new medicine like Genentech, etc., which also is in the biotech general space. And then sixth is robotics. So which is use robots for surgery. You may have heard of Da Vinci. So, a doctor can use a robot to perform a surgery, and that uh, also within hospital operation, where taking medical supplies from one let's say department to another or patient to another could be done by robots. So these are the 6 categories: wearables, remote health, personalized medicine, AI, pharma, and robotics. And within these, I see, I think, except pharma, which I think is a very, you need a lot of capital to do that. All the others are open for innovation to startups. Some are easier than the others. Wearable space, generally consumer wearables, don't require FDA approval. So that's why you see more companies trying that, because it just takes a long time to get approvals from the government. And also, you can't apply um, because lives are at stake. So the whole idea of MVP doesn't really work here, because the lives are at stake. MVP meaning minimum viable product. So the product has to work, and it cannot risk human life for it to be working in the field. Okay, Arne, now can you share, GDPs and why it's an open space for innovation?
Yeah, just a tangent of the last story. Yeah, so like in consumer content, moving fast and break things works great. In digital health, not so much.
Yeah.
Yeah, no, I think, healthcare is an industry with huge potential for innovation and efficiency gains, but it has these friction points that you talk about. But I thought it was interesting to talk a little bit about the sort of why is it so, and the macro numbers for that. And this even gives a Nordic person the opportunity to bash the US a little bit, which obviously feels great, although I'm deep down a fan of the US in many aspects. But one area where there's absolutely no reason to be a fan of the healthcare system or of the US is the healthcare system. So if you look at healthcare, it's one of the biggest drains of resources for good reason in a society, but even so, it costs a lot of money. And in the US, about 17% of the GDP is spent on healthcare. And this is obviously a huge part of the GDP, but it's also completely out of proportion with the rest of the world. So Switzerland spends 12%, Germany, France, Sweden 11%, and so on. Norway, Denmark on the 10% range. So the US spends much more money on it than anyone else as a percentage of GDP. What's even more...
They don't even provide it to everybody. I think there are 30 million people who don't have healthcare.
This is exactly my next point, right? So even if the US spends a lot more money on it than anyone else, I would say all the countries from number 2 to number 15 has universal healthcare. Mm-hmm. And the US does not. 13% of the US population do not have access to healthcare through insurance policies. So that's so coverage is much worse. And to make it even worse, it's actually less effective. So the US has, let me look, this is 2014 numbers, about 70 preventable deaths per 100,000 people, which also leads any other Western nations with an advanced healthcare system. So the US underperforms on cost, underperforms on coverage, and underperforms on performance when it comes to deaths, particularly. And the only way the US actually performs is access to specific care to specific people. But in general, it's a sad story. But the fact that it costs a lot of money is shared across the Western world, and it costs more every year. So regardless of which country you are looking at, the need for innovation and improvements is huge, but it's more so in the US than anywhere else. And that's why it's a very worthwhile industry to go after with new technology to try to help patients get better outcomes and also save money.
Yeah. So can you talk more about, what are the inefficiencies in the US healthcare system? Why is it so expensive?
Yeah, so I think there are multiple reasons for it. If you look at a list of them, I think more administrative cost is reason number one. That just means the healthcare system is split into multiple different entities, and there are a lot of people, administrating it to make it work. Insurance claims and blah blah blah, billing, detailed billing, and reimbursement codes, and all of those things that don't actually provide any care. There's sort of a story about how Duke University Hospital that has 900 beds have 1,300 billing clerks. So that's like the ultimate example of being over administrative. I think there's also the fact that drugs are more expensive than the US. That is partially because it's a big market and it's the primary market where pharma reclaims R&D expenses. But it's also because it's very inefficiently set up for buying drugs and getting rebates because it's fragmented. I think the US system is known for over testing, just to limit liabilities and this sort of thing. I think it's fair to say that healthcare professionals, particularly doctors, are better paid in the US, but it's also as an effect of having a very expensive education. And there's actually this thing of, because it's a consumer service, branding comes in. There's a lot of money being spent on branding and marketing, and it's not necessarily the best and most efficient care that's preferred by consumers. Is actually the best branded care. So I think there are a lot of, it's a sector where the market economy that works very well in other sectors don't seem to work very well, to be honest.
Yeah, you're right. So that makes it ripe for innovation, but we've been saying that for decades now, but not much has changed.
Yeah, so I think there's some sort of fundamental reasons why innovation and technology has a hard time sort of breaking through and giving the big, sort of releasing the big potential that you've seen technology do in other industries. And I see like three main speed bumps for like some leaner, more innovative models funded by venture and angels and this sort of thing. And one is clearly regulation and approval procedures, which is a safety valve. But even so, for those offerings that need to be approved by clinical trials and so forth, it just takes a very, very long time. And with time, money or the cost sort of accumulates as well. So regulation, time, and money is tightly coupled. The other big friction point that I see is essentially that it's because it's a big industry with big players that are sort of providing the care. It's very complex procurement processes that are very hard to maneuver, particularly for small companies. And this is these things are universal. This is not particularly to the US. The procurement problem is possibly even bigger in a centralized healthcare system in Europe, for example. So there are just fundamental speed bumps in the industry. And I think, if you're a startup, it's very important to be aware of these speed bumps and maybe find propositions that either can go around those and not deal with something that's heavily regulated and possibly being supplied directly to consumer, or piggybacking on somebody who has regulation and sort of filling in the gaps of efficiency by delivery of using technology. But it's not an easy water to navigate.
Yeah, I think somebody explained it to me. So like 8-9 years ago, I was deeply immersed into this space because I was leading a team that was developing the first consumer multi-sensor wearable that was cloud connected, which is in the Computer History Museum now in Mountain View. So somebody said, it's, you don't see law changing because if things change, there are a lot of losers, meaning a lot of people or companies who are making a lot of money today will stop making money if you actually change the system. And the system today in the healthcare world is all based on cure. So their incentive is not to keep you healthy. Their incentive is to cure you. And the longer it takes to cure you, the more money they make. And second, it's based on event-based decision-making rather than continuous data-based decision-making. What that means is you go to the doctor when there's something wrong with you. So the doctor looks at your body or symptoms at that moment in time. They don't have access to data, for rest of the time. So like throughout the year, 10 years, maybe you're allergic to something, this happens every August or whatever it is. I think these are two of the fundamental things that can change now with the cost of sensors on decline, the connectivity in place. You can turn the system upside down, make it prevention based, not cure based, and make the diagnostics based on continuous data rather than event based data.
Yeah, definitely. So the whole sort of sensing space and the data analytics / AI waves have huge potential if it's applied in the right way in this particular industry.
Yeah, so there are some things happening in that space. So the Apple has this app called Research, where companies can do actually studies. You can participate, download the Research app and participate in studies. So they measure things, how things are affecting you. So you do that in the field. So the study is happening now through Apple Watch. And then they also have an initiative with like now more than 200 healthcare, not units, but basically hospitals, where the identity is, you can use your Apple Watch or Apple in the healthcare app to have your identity. Basically, all the information doctor gets is through that. So that's also very helpful.
Absolutely.
So when I was deep into this, I chose at that time to stay with the consumer wearable, which did not require FDA approval. So in your portfolio, Arne, of the 6 categories I outlined, do you have startups who are working in other areas?
Yeah, so in my portfolio, we don't have a huge section of digital healthcare companies, for the simple reason that we haven't found the right ones that sort of attack it in going around the speed bumps as we would like. We do have, like, for example, sensor companies. And an interesting analogy, for example, is that we've invested in a a company that does computer vision and AI, but aimed at fish farming. So it's essentially digital health for fish. But clearly the regulation about providing healthcare for fish is different than for people, and hence the go-to-market is faster. But the sensing and the data analytics approach is very similar to what you would do for human beings, essentially. Although hopefully not too many people have lice.
So that's interesting. Can you tell us the name and what exactly does the company do?
Yeah, so the company is called Aquabite. It's a San Francisco, California, and Bergen, Norway-based company. They provide a platform, software platform that utilizes AI and machine learning to look at and learn from pictures that are taken in a fish cage underwater, where there are lots and lots of salmon, and also they can then detect sea lice, which is one use case. And sea lice is a pest so that you have to treat if there are too many of them in the water. And so that's a health monitoring use case. But the platform is actually a multi-use case platform where they use the same images and different analytics packages for multiple purposes. The other product that's in the market currently is biomass, which is essentially about evaluating how much the fish weighs so that it fits a growth curve for the market. But there are a number of other health applications in the pipeline for this company, because once you establish the data capture through cameras and an analytics platform with access to those images, you can do a lot of different things. And that's very analogous to what you would do for people if you have pictures or X-rays or CT scans or whatnot in sort of the sensing to data analytics area that's very active today.
Yeah. And can you think of like companies, Theranos, that gave healthcare startups a bad name, because Theranos, people who haven't heard of it, was a startup in the Bay Area that was doing blood testing, basically with one drop of blood rather than drawing blood through a syringe. So they had they were faking results or doing testing through normal machines but telling everybody they have their own machines. So the companies closed and they're fighting a court case, etc. But that, I think, made people skeptical about at least in the Bay Area investing in healthcare companies, because it's a very different model than the normal, let's say, software startup. Like we were talking earlier, like Arne said, you can't move fast and break things, or can't pretend that you will have things ready, which happens a lot in the software world. So do you see in the Nordics, is it more money going into healthcare startups, or what is the area of research or not research, investment in terms of digital health in the Nordics?
Yes, I think one area that's been coming up, and we've had startups in multiple countries, is more about the digital provisioning of care, which is more about the remote angle that you talked about. So instead of going to a primary care doctor face to face, it's maybe through an app where you provide data about what you're doing. So there's some sort of triaging of symptoms before you get to the doctor, and then you meet the doctor over a video link. It's very efficient. You get a prescription based on that. You go straight to the pharmacy. So there are multiple startups. The most successful and biggest one in the Nordics is called Kry. They just raised $155 million round, and they're in multiple European countries with this sort of digital primary care provisioning on a consumer model, even if they do also business subscriptions. But the whole idea is that it's quicker than going to your general practitioner or your primary care facility, And as data grows, it will become more efficient in providing the care as well, because it's one centralized platform. So these we have multiple of, and these are startup-y, although some of them have grown to be very big startups. The other thing I talked about the analytics, sort of the sensing analytics angle to it. This is, as you understand from earlier discussions on podcasts, I'm big on the AI space. And whilst I think if you sort of take big data sets from hospitals and you want to crunch them and they're known data sets, I think this is sort of the game that, well-known hospital chains, together with players like Google and Microsoft and this sort of thing, I think that's a domain where they play well. However, I think if you can find novel data sets to analyze, there is room for startups to play. So I can explain two examples that are specific in the Nordics. One is a company that we've invested in. They're called Novelda, and they're playing in the sensing part, but it could be enabling in a broader sense. So that's a radar sensor, and it's currently being implemented in sort of consumer electronics applications for simply finding out whether there's a person interacting with it. And it's doing that by measuring the respiration of the person. So you can do positioning and respiration monitoring, and down the road, you can also do pulse measurement from remote. Now, I think, the use cases in the near future is more sort of controlling devices and that sort of thing. I think, though, in the long run, these sorts of sensors will be in all consumer electronics, including, TVs and smart speakers and this sort of thing. And if you put that into a system where over time you have a large population of people in the home you can have data sets on their movements, on their respiration, and on their pulse over time. This is a very fertile ground for analytics, for diagnosis going forward. But it's a big game where the company I'm involved in sort of plays a smaller role, but an important role as an enabler. Another example in the same sense, there's a Norwegian company called Onio. They are building a disposable continuous thermometer. So today, if you're sick, you measure your fever and then you get a reading. If you go to the hospital, there are sort of continuous fever measurement or thermometers for measuring fever, but they're big devices. If you can put this in the consumer domain, and you can measure temperature of people without too much inconvenience over days, you can get temperature patterns.
Yeah.
And that can be input to, when you start knowing the temperature pattern of people, that is useful for diagnosis, whether you have the measles or the influenza or coronavirus, essentially, when you know the patterns, or malaria for that matter. Yeah. So this is a novel sensing again. It's not in the market combined with the right data science. You have to do enough with the device that it's safe to use, but that regulation is not too bad. Secondarily, if you want to do a firm diagnosis, it's highly regulated. But if it's a data set that is a supplementary data set that the doctor will look at and ask questions, it's an augmented system that might not be too heavy on regulation, and once again can provide tremendous value. So I think there's room for startups to play in this space.
Yeah, definitely. And I would add to that, there is a lot of, I think this is a global mega trend. There are a lot of, people in general are living longer. The average lifespan has increased. And when they're older, many of them live alone. So if you can develop technologies that help them, basically if they fall, get a notification, or if they have change in some kind of diagnostic, if somehow you can bypass the healthcare system, because that takes time and you get approval, just the children of those or friends of those people, if they can notify it if something extraordinary, I think that's also a big opportunity.
Yeah, so the radar sensor I talked about before, there are customers there using it for remote monitoring of sleep. So if you measure the respiration pattern over the duration of a sleep, you can tell something about sleep quality. And there also have people who've tested it for fall detection for elderly care. And once you have like consumer devices with sort of sensing capabilities, it's more a question of building the application and software on top, what you're looking for and what you're tracking and what you use that data for.
Yeah, yeah. Oh, yeah. I also want to mention in Skåne, which is in southern Sweden, they have now over 200 startups focused on mobile health. So I worked with them, I think 5-6 years ago on innovation policy, and that was my advice, that focus on mobile health, because you have the RF or radio engineers from Sony Ericsson days, and Lund University has, history of medical innovation, so combine them. So I think that's like that ecosystem is growing. So that may be an area, if you're in the Nordic, see what's available to you if you are in healthcare space or digital health space as a startup.
Definitely. Yeah. And you mentioned here the elderly care. I think this is one big bulk of opportunity going forward, because as we all know, Western society is growing older, a larger part of the population being elderly and living longer, and the cost of that is big. So although the delivery and the capabilities are not necessarily so different from the buckets you described initially, or the applications we've talked about here, the whole sort of provisioning of care, provisioning of or assisted living, and making that safe, I think is something that doesn't have to necessarily be super regulated, and sort of more consumer oriented offerings can enter that market.
Yeah. And I think we also have to broaden the idea or the definition of healthcare or digital health. Meaning, this is relatively new, the idea of mental health as part of the healthcare system. But I see in Japan, they're developing robots which are emotional support aids to older people who are living alone. So that could be another area. So not just, think more broadly about what healthcare is. It's not just physical, it's also mental healthcare.
Definitely. So one good example there that's quite interesting is, I guess we could call that space even sort of digital therapeutics, but it's more by using technology to bring about behavioral changes, which prevents diseases. So it's also in the preventive care space, but as a supplement to medication. So there's a company that was part of the Nordic Innovation House community that both Chandra and I sort of belong to, called, sorry for not remembering the name right off the top, Sidekick Health. So Sidekick Health is a Swedish, Icelandic, US company. They have like apps for people with heart disease, diabetes, and that sort of thing. And it's digital therapeutics that supplement the medication and try to reduce the medication and improve life quality and likelihood of healthcare benefits. And it's sort of working together to make the life of the patients better. And I think this is also an interesting. So it's sort of gamifying behavioral change when that impacts health.
Yeah, yeah. So let's say, we are starting a healthcare related startup. What would you advise them? How is the field of healthcare is different than, B2B SaaS model, which you love? one thing we talked about is you can't move fast and break things. Human life is at risk. The MVP model doesn't really work. What else would you tell them?
So I would tell them, if they're deep in the providing a medical benefit, so that it's a the pharmaceuticals or the deep biotech or the medical device or something like that, you need to find specialist investors and not waste your time talking to somebody like me, because like the clinical trials and the whole regulatory framework is not something that people like me should be giving any advice on at all. If you're more sort of on the side of let's find an efficient way of doing this, how do we do analytics on this so it has this benefit, sort of the more sort of augmented efficiency, consumer oriented thing, I think it's a lot about finding a way to the market that's reasonably efficient, while at the same time providing the benefit that's intended. And that's a lot about trying to figure out what are those speed bumps and can they be circumvented, mitigated, or passed in a speedy way, so that it looks like a normal startup in the sense that you can move reasonably fast even without breaking anything.
Yeah, good. So I think we should end here, because I noticed our last episode was the longest episode ever. So we should make this one shorter one.
I blame it on Per Arne.
It's kind of funny. It was Arne and Per Arne.
Yeah, exactly.
Yeah. So I think there is a lot of opportunity on the periphery, like you mentioned, but let me end with this thought. The fundamental change will happen when the actual change in how we think about healthcare changes, meaning it becomes more prevention oriented, and then we look at continuous data than event-based data. Also, I want to remind people, since we are going through a downturn in economy, Arne and I have an episode on how to manage your startup and operations during economic downturn, and that's season 1, episode 25. So if you are having tough time raising money or trying to figure out how to reduce cost, you may find that useful. It's season 1, episode 25.
Can I also have a last comment here?
Yeah.
And given that we're in sort of Corona, the time of Corona, and people are in lockdown everywhere, and if people are listening to us, I think it's worthwhile in this situation also to give kudos to all the real healthcare professionals out there who's saving real lives in situations where lots of people are uncertain and afraid, and where resources are really stretched in some areas. So definitely kudos to the real healthcare professionals out there.
Yes, thanks for reminding me. I posted that on Facebook a few days ago, because I genuinely feel indebted to them. We are working from home, and people in healthcare, doctor, nurses, and all the staff in hospitals, they're out saving lives and protecting us. So yes, thank you. Okay, thanks everybody. We will see you next week. Hopefully the situation is more under control regarding coronavirus.
All right, all the best. Stay safe and healthy out there.
Yeah, thanks. Bye.
Bye.